Hi, everyone. My name is Subin,
And my name is Alan.
and we're part of the Breathing Better and Smoking Cessation Club. So today we'll discuss allergies and breathing now that the weather is warming up and spring is around the corner. So a flare-up is also known as exacerbation, and some symptoms of a flare-up include morning headaches, fatigues, gray or pale skin, coughing, phlegm, or you may notice a change in color in your phlegm, noisy wheezing sounds, some increases in shortness of breath. You may be unable to take deep breaths, some abdominal pain as well. But there are also some signs that you should be looking out for in case it leads to a more severe flare-up, in which case you should be calling 911 right away. So some of these signs include chest pains, extreme shortness of breath, dark mucus, drowsiness or confusion, frequent headaches, blue fingertips or lips, and these signs are especially important if you have COPD. And now we'll talk about some triggers of flare-up, so what causes them. So one example is smog and other kinds of air pollution, as well as strong fumes. So pollutants like car fumes and dust can irritate the lungs and the airways. And air pollution can cause sudden flare-ups of COPD symptoms, which then increases the risk of complications. High ozone levels have also been observed as a factor. So ozone is known to irritate the lungs by increasing inflammation, which can exacerbate lung diseases like asthma. And ozone levels increase mostly in the afternoon and the summer. So during this time, try to avoid doing outdoor activities and move them to earlier in the morning if possible. Another factor is cigarette or cigar smoke. So according to the American Lung Association, smoking causes 85 to 90% of all cases of COPD, and inhaling tobacco smoke can worsen existing symptoms. Smoking can damage the lungs by causing inflammation, it can narrow the air passages and destroy the air sacs inside your lungs. In people with COPD, smoking can irritate the airways, increase the risk of lung infection, and speed up the disease progression. During this time, if you have COPD, you may also want to avoid secondhand smoking. Another factor is humidity, which also changes with season. So humidity refers to amount of water vapor in the air. It's higher in the summer and usually lower in the winter. And higher humidity may feel like thick or dense air. You may also find it more difficult to breathe. You can also feel like you're short of breath and tired. High humidity also helps grow mold and dust mites, which both of which trigger COPD symptoms and flare-ups as well. And a 2017 study found low temperature and high humidity were associated with COPD symptoms. And so to help address high humidity issues inside your home, you may consider investing in a dehumidifier. On the other hand, low humidity causes air, throat, and sinuses to feel dry. And so during this time, viruses such as the flu can spread easily as well. If you find that the air inside your home is dry, you can try to mitigate that by using a humidifier. And if humidity is extremely low, try to limit outdoor activities in extreme weather or humid conditions as well. In general, it is recommended to keep room temperatures above 18.2 Celsius or 64.8 Fahrenheit, and to ensure that the humidity level stays below 70% for those with COPD.
Perfect. Now I'll just be quickly covering over the last trigger for a flare-up, and that is allergies and allergens. So the one that comes to mind is namely pollen, as that's probably the most obvious springtime asthma and allergy offender. And as flowers, weeds, trees, and other grass and plants begin to bloom, they'll release pollen into the air. And if you're allergic to pollen, you certainly will know what happens next. Even things such as insecticides, sunscreen sprays, and bug spray, all things that you use in the summer, can also trigger symptoms as there are fine particles within the air. Allergic reactions can cause symptoms in your nose, lungs, throat, sinuses, lining of the stomach, or even on the skin. And allergies can also trigger symptoms of asthma, making it more difficult to breathe if you do have asthma. And pollen, keep in mind, isn't the only spring allergy and asthma trigger, as there are different types of pollen as well. In terms of why you may feel full-blooded response, we just want to quickly cover over the science behind it. When your body's exposed to allergens, you'll produce histamines, which can trigger a lot of symptoms like itchy eyes or sneezing by stimulating nerves, glands, blood vessels in the upper and lower respiratory tracts and increasing swelling and secretions. So if we take a look at the diagram, pretend that on the left-hand side, these green circles are actually pollen, and they're actually interacting with the cells to release histamine. And as a result, histamine causes swelling and secretions, and this can lead to increased airway resistance, coughing, and even mucus production. Now we can see how this combination of severe allergies along with COPD existing symptoms can lead to a COPD exacerbation. And therefore, I hope that we can see that managing spring allergies is a must if we do want to reduce the risk of this sort of double attack on our body's respiratory system. Now, on some strategies in terms of what we can do to help, we have 4 outlined here. So the first one is to just simply know before you go. It's important to just check the pollen count before going outside, as that can be helpful in terms of helping you gauge when is it best to stay indoors. Checking out your local pollen report before you leave the house on many weather sites such as AccuWeather can provide local information on the current pollen and overall air quality around your local area. The Weather Channel has an excellent allergy tracker that also provides the levels of particular types of pollen, including trees, weeds, and grasses. And with this information, you may actually wish to plan outings on days when pollen and mold levels are lower to reduce your allergy symptoms. Alternatively, you can also schedule activities so that you're not outdoors when pollen count is at its peak. Researchers have found that pollen typically peaks around 5 to 10 a.m. So any time that you can do an activity outside of those hours is great, as it will greatly decrease your risk for an allergic reaction. And sometimes just knowing when is it best to stay inside when the air in your when air quality in your area is poor. For people with COPD, an air quality index of above 100 can really wreak havoc on your respiratory system. And sometimes it's just uh, way better just to stay inside at home. Secondly, we just recommend keeping a journal. Many of those living with a chronic lung condition should keep a journal of their symptoms, and this should include information such as those environmental conditions they faced and how they've affected their breathing for each day. On what days did they find their breathing to be great, no issues, what was the environment like, and vice versa. And much of learning how to improve your symptoms is just a matter of experimentation. Maybe for one person at a certain time of the year, campfire smoke will bother them, but it may happen again with a different type of wood, and it may, in fact, not affect them as badly as a certain type of other wood. It's really about just catching these symptoms early and just learning what causes you problems and what doesn't, so that you can best tailor your environment. And by journaling, COPD patients can also help become more aware of what affects their breathing and just learn to avoid those irritants in the future. And tying nicely into this point is after knowing what are your triggers or what are your causes, we can allergy proof our environment. So this obviously it depends on the context and living space that you're in, but whenever possible, just try to take some of these measures to just keep allergens out of your space. So here's some things you can actually do at home. The first thing is to just simply install a good filtration system in your air conditioner and to replace that on a regular basis. The second one is just to simply practice good hygiene and sanitary skills. This includes vacuuming and dusting regularly to get rid of any pollen or any mold spores that may have gotten from the outside inside of your room. Another thing could be just simply changing your outdoor clothes when you get home each day so that you're not transferring pollen that has stuck onto your clothes to potentially your furniture or bedding where you'll be sleeping and spending more time in a vulnerable position. And finally, just knowing when to keep your windows closed when pollen counts or pollutants may be high. And this ties back into point number 1 about just knowing your environment and the air quality that day. And finally, talking to a doctor. This involves talking to a doctor about your conditions, seeing what medications and what inhalers you have, and how to use them properly. We have a lot of YouTube videos about how to breathe properly, when to take in extra puffs, what do you do when you have an exacerbation or flare up. And it's important that you have this expert advice so that in case things do go wrong, in case where you're not able to adjust your environment, you do have that safety net with you to help you. Now, before we send you off, we just want to quickly just plug our smoking cessation group. This was originally started by an old volunteer of ours, Winnie, who's currently at medical school. And now Subin and I run this program. We call on 2 days of the week. And then quite simply, we're here to just help you become better with your smoking habits, whether it be quitting or even just simply reducing it. We're here to talk to you. We're here to support you. We're here to see how we can best help you in your smoking habits. And so if you're interested, please just let Dr. Curnew know, or just give the clinic a call, and we'd be happy to schedule in for your call. With that being said, we hope you really did enjoy this presentation. Hopefully the weather gets better, and with that, hopefully so can your breathing too. Thank you so much. And yeah, if you have any questions, you can always contact us at the clinic.